Thank you. Thank you so much. Uh, so, as we all know, physician burnout has personal and professional repercussions. On the personal side, physicians or the healthcare professionals have highest rate of depression, suicide, and alcohol abuse and broken relationships. On the professional side, due to burnout, there is a decreased quality of care, increased medical errors, decreased patient satisfaction, physician turnover rate, and decreased productivity. Um, and professional, I mean, healthcare professional burnout has many consequences. For example, Association of American Medical Colleges project physician shortage of up to 140,000 by 2033, and one in five physicians leave their practice within next 2 years. And National Academy of Medicine declared physician burnout as a public health crisis. And physician burnout costs healthcare systems billions of dollars across the country, and there is an exponential rise of physician burnout for the last 4 years. And also, there is a stigma of mental health in healthcare professionals. According to a survey done in 2012, there is 50% believed they had a mental health and not sought treatment for that. Especially in the post COVID era, healthcare professionals are even more siloed and distressed. So the stigma of mental health in healthcare professionals, there are various programs that are trying to help, but the physician utilization rates are very minimal, and accessing programs is often difficult, and because of various reasons like regulatory and confidential reasons. So today we want to introduce this concept of physician peer coaching, which is a unique process where a physician who is trained as a coach uh, and also have knowledge, experience, and wisdom about the challenges of the current healthcare system. And Because of this, the fellow physicians and healthcare workers connect better with a physician coach. Physician coaching Physician peer coaching offers a psychologically safe space for the development of meaningful connections and encouraging conversations, including the values, the vision, and the goals of the fellow healthcare professionals. So, for example, if you see this slide, a basketball player can relate better with the basketball player. A football player can relate better with a fellow football player. Uh, uh, Peer coaching works. In the same way, physician peer coaching, our hypothesis is physician peer coaching decreases burnout in hospital based physicians as measured by Maslach burnout inventory, areas of work life survey, and physician satisfaction scale on a scale of 1 to 10 about emotional health, professional support, and the career. So we will measure this at baseline 3 months, 6 months, and 9 months. So the location, it is a multi-site integrated health system with around 5 to 6 hospitals in Geisinger Health System. And the research design is a randomized control study, involving physicians from emergency medicine, hospitalists, pulmonary critical care, radiology, OB-GYN, neurology, hematology, oncology, trauma surgeons, pediatric ENT surgeons. Um, so in this study, we are comparing physician peer coaching versus the standard mentoring, the control group. Intervention, 6 coaching sessions using Microsoft Teams over a 6-month period. The first coaching session is for 1 hour, and the next 5 coaching sessions are 3/4 hours, a total of 4.75 hours. So we used this format of coaching called cheer format for coaching sessions. C means celebration. Start each coaching session with physicians sharing their most celebrated moments, personally or professionally. H means hearing. Create a psychologically safe environment for the physicians to share their thoughts about the personal and professional burnout, as well as efforts to improve wellness. E means coaching, executive coaching. Utilize thought provoking, creative process that inspire physicians to achieve their goals and maximize their personal and professional potential. It is kind of like a self discovery process. Engagement. Encourage physicians to share their own ideas and be an active participant. R means recharge. Discuss and implement strategies that were discussed during these coaching sessions to reduce burnout and to improve wellness. So, in the initial session, we create the relationship, assessing the needs, identifying the values, challenges, what are the requirements, what are the goals, and create an action plan. In the subsequent sessions, we'll check in and debrief the strategic action plan and the actions that were taken so far, and design actions to incorporate into daily life and commitments to the next steps. If there are any obstacles in accomplishing that, we will discuss during the during these coaching sessions. The core themes we discussed were personal values, goals, meaning in work, work life integration, leadership, social support, community at work, and career development. All the coaching sessions were virtual, unscripted, and individualized as per the needs of the physician. So we used Maslach burnout inventory, which is a gold standard for measuring burnout. There are total of 22 questions about job related feelings on a score of scale of 0 to 6 in three areas. So emotional exhaustion, depersonalization, and personal accomplishment. I'm sure all of you are aware of this scale. Um, and the second scale we used is areas of work life survey, which is also developed by Maslach. It is a total of 28 questions scoring in the six areas as shown below. It is basically employee perception of workplace. So, for example, workload. Are you working intensely for long hours? Do you leave work behind? Do you have interest? Do you have time for your personal interests? Control. Do you have independence and autonomy about the work? And reward, recognition from the others. And do you receive any sense of appreciation? Community. Do you have supportive work group or cooperative environment? Fairness. Are the resources allocated fairly and equal treatment of all employees? Values. Is personal goals consistent with organization? I'm just giving some idea of how this scale looks like, but there are 28 questions, but this is the brief theme of employee perception of the workplace. And we have almost 650 eligible physicians, and out of that 51 were randomized and consented, 25 allocated to intervention arm, 26 allocated to control arm. So after 6 months of coaching, this is a crossover design, and the intervention group will become and the control group will crossover. So we requested the control group to meet their mentors and follow the institutional wellness. So we encourage them to do in the control group. But then in the interventional group, all these physicians met with the coach once a month, as I described before. So this is the subgroup characteristics At baseline, there is no statistically significant difference between the two groups, except the sex, where in the control group, male is 77 and female are 22%. And all the other subgroup characteristics, there is no statistically significant difference. Number of years of in practice, number of hours worked per week, proportion of time spent in direct patient care, these are all, as you see on the screen, no difference at baseline. In the same way, baseline Maslach burnout inventory scores, there is no difference at baseline. And baseline areas of work life survey, no difference at baseline. No statistically significant differences between Maslach and areas of work life survey at baseline. So now we are entering into the result section, where overall burnout percentage, when you compare intervention in the orange and control in the blue, on the x-axis the time, 0, 3, 6, 9 months. On the y-axis, percentage, burnout percentage. So if you see in the intervention, the burnout decreased from 60.9% to 33.3%. That is a 27.6% decrease in the intervention group. But in the control group, it's only 1.2%. So the p-value trend is less than 0.05%. So this is the same statistic as I described before. Control group, 59.1% to 57.9% after 9 months, and the intervention group 16.9% to 33.3%. And emotional exhaustion total score, on the orange is the intervention, it decreased, the total score decreased from 30 to 17, and in the control group it's 28 to 27. So there is a 13-point decrease in intervention group versus 1 point in control group, a p-value trend less than 0.01. The depersonalization total score, intervention and control, it's in intervention 6 to 3 after 9 months, and in the control 7 to 6. It is a 3-point decrease in intervention versus 1 point in control. But you can see the longitudinal trends here. Baseline 3 months, 6 months, 9 months. But overall p-value trend is less than 0.01. High emotional exhaustion total percentage, decreasing from 60.9% to 23.8%. In the intervention group, it is a 37.1% decrease in intervention group of high emotional exhaustion. And in the control group, it is 34.5 to 32.6. It's 1.9%. So p-value is less than 0.01. And workload average, intervention to control, the workload, the perception of the workload actually from baseline to 9 months, it improved in the intervention group when compared to the control group, p-value less than 0.01. So this table gives the summary of the baseline 3 months, 6 months, 9 months of Maslach burnout outcomes for the intervention subgroup. The p-value trend, see, almost every subsection we have statistical significance, except high depersonalization, n percentage. So this is such a important trend and outcome that shows the impact of physician peer coaching in the intervention group. And this is the graphic representation. If you see overall burnout, it is almost up to 60% at the baseline, and it decreased up to 30%. And high emotional exhaustion, it is 60.9% to 23%. And same with the depersonalization. So the trend of this graph with physician peer coaching, the burnout is decreasing every 3 months. And areas of work life survey outcomes for the intervention group. So far we discussed about the personal factors. These are the systemic factors. After 9 months, the p value is less than 0.01. The employee perception of workload actually statistically decreased, and the people felt they were rewarded more with the physician peer coaching. I will give you few stories where, while during the coaching journey, there were instances where people, due to heavy workload at the baseline, they are going home at 8 p.m., 9 p.m., missing dinners for last many months. But with physician peer coaching, we were able to move that needle, and people were able to go home in a reasonable time, to because this is accomplished because the workload was managed following various techniques. And also the same with the reward. In this journey, it's just the coaching process. We never reached out to leadership to change anything, that intervention group gets less patients and control group gets more patients. Nothing like that happened. All this impact is due to the coaching process itself and the various things we discussed during this process. And when you see a Maslach burnout inventory outcomes for the control subgroup, uh, baseline 3 months, 6 months, there is no statistical significance across the board. Emotional exhaustion, depersonalization, and overall burnout across the six metrics, there is no statistical significance. And the same with the areas of work life survey outcomes for the control subgroup. Baseline 3 months to 6 months, there is no impactful outcomes or statistical significant outcomes in the control group. And now these graphs will show the 3 month difference in difference analysis showed personal accomplishment is the first one within 3 months, which reached the statistical significance when you compare intervention to control group. And the 6 months difference in difference analysis, emotional exhaustion total score, there is a statistically significant difference p value of 0.04 between the two groups. And Maslach burnout inventory at 9 months, we see high emotional exhaustion percentage, it's decreased statistically significant, 0.05. And areas of work life survey, 3 months difference in difference analysis between intervention and control, p value less than 0.02, where intervention has more better better workload. And in the same thing with the 6 months difference in difference analysis, where the workload average for the intervention versus control reached significance, p value 0.01. And 9 months between intervention and control group, workload and reward average showed statistically significant difference, where workload average p value 0.03 and reward average p value 0.02. And on top of that, we always hear patient satisfaction survey, so we put a physician satisfaction survey for the these are the outcomes for the intervention group. It's a scale of 1 to 10. 10 is the best and 1 is the least. How satisfied are you with your emotional health? Baseline 4, 9 months 8. It is an improvement uh, of 4 points and p value less than 0.01. How satisfied are you with your current professional support system? Baseline 2, 9 months 7, a change of 5, p value less than 0.01. And how satisfied are you in your career? baseline to 9 months 7, a change of 5, p value less than 0.01. So in summary, there is an improvement in Maslach burnout inventory in the intervention group across the across various dimensions, and also in the areas of work life survey, and also in the physician satisfaction survey. And these are the remarks from the physicians taking part in coaching sessions. Coaching sessions gave me the opportunity to schedule self reflection time where I was able to focus on goals, my work life balance, and mental health support. As the theme of the conference is the mental health support, you can see because of the psychologically safe space, and also the investment we put in this coaching, because we the physicians and the surgeons felt this coaching sessions are really helpful for their mental health support. And also the session start, the second participant said, seconds taught me vital strategies to control stress, anxiety, and work on what gives me happiness and makes work more enjoyable. So this is also an aspect of emotional health and mental health support. And the third participant, these sessions were filled with positivity and helped me develop a sense of accountability for goal setting. Now we got so much feedback, and we divided these remarks from physicians into personal benefits and career benefits. Personal benefits: human connection. As we all know, that human connection is critical to have better mental health, and the re-energize and reconnect. These coaching sessions provided support, and they also helped physicians to take back control. And people are, to give an example, one of the physician has an inbox, like emails of almost like 40,000 or close to 30,000. But once we started this journey at the end of the coaching sessions, it's almost reached less than 100. uh, uh, so self discovery process, these coaching sessions help the participants to raise the expand the awareness, and help the self discovery process. And growth oriented mindset boosts confidence, and these sessions help to bring clarity. This is what the participants said, in the personal benefits section. In the career benefits, uh, we discussed about, the studies, name itself is cheer. We are big on positivity, celebration, appreciation, and also action plan creation. During these coaching sessions, we discussed about what is your 3-month goal, 6-month goal, 1-year goal, 10-year goal. And during the sessions, we keep on discussing about how they can accomplish these goals. um, and also we discussed a lot about career improvement, career, and creating community, not only within locally but also nationally and internationally. So the potential benefits of physician peer coaching, as I said, physicians will relate well with the fellow physicians. Lot of participants, actually, this is a surprising outcome. When I am designing the study, I never anticipated this much impact. The coaching, physician peer coaching, especially when a physician becomes a coach. And after the completion of the study, at least I will say, 40 to 50% of physicians want to become coaches, and they asked me to train them to become coaches. So how the impact is because the trust and the relationship they developed with the fellow physician during the 6-month process. um, and the safe space, providing psychologically safe space to find solutions and ways to thrive. And the third is, as I mentioned before, develop an executive plan for short term and long term goals, but also provide accountability to accomplish. Always during these coaching sessions, we always ask, hey, how are you in this journey? Life happens, new things happen, and always physician will drive what they want. um, we gave that much autonomy, and also we understood how busy the physicians and surgeons are, and we are very adaptable to their needs to accommodate their timings. There were times we did coaching over the weekends or the nights, very early in the morning, like, you know as per the needs of the physicians. So this kind of caring and supporting our fellow physicians and surgeons will that's the reason why this study is very positive. And some themes discussed during these coaching sessions: optimizing meaning in work, and integrating personal and professional life, building social support and community at work, improving work efficiency, building leadership skills, educational and research plans, career development, purpose in life. We discussed always about what is the purpose in life, what brings joy in medicine. We always discuss these core themes during our coaching sessions. And of course, every study has its own limitations. This is a single integrated health system study, and the follow up is only 3 months. And areas of work life survey results are specific to single integrated healthcare system. And the conclusion: coaching, physician peer coaching, decreased emotional exhaustion and high emotional exhaustion scores at 6 and 9 months. Physician peer coaching led to significant trends in decreasing emotional exhaustion, depersonalization, overall burnout score, and high emotional exhaustion percentage, and increasing personal accomplishment scores over 9 months as per the Maslach burnout inventory. Coaching improved areas of work life survey reward scores at 6 and 9 months, and had significant trends in improving workload and reward over 9 months. Physician peer coaching significantly improved physician satisfaction with emotional health, professional support, and career at 3, 6, and 9 months. And if you have any questions, please feel free to reach out to me. My email is drtadir@gmail.com. And thank you so much for giving this opportunity for present here, especially Champion of Wellness and all the participants and all the speakers and PJ and their team. Thank you. Appreciate it.